empathy is usually more of a feeling of pity for another. Yani, unasikia tu vibaya. It's you, not them. It's you. You feel pity for another. But now when you come talk about empathy, it's usually our ability to understand how someone feels. While sympathy is a relief in not having the same problem. So empathy is, let me use lay terms. Empathy is more of understanding how someone feels. When someone tells you, I feel hurt, you're able to relate with their heart. You're able to, feel that heart with them. When someone tells you, I feel loved, you're able to feel that love with them. But then when you look at sympathy, it's more of, pity, ni wewe. Unasikia akiwoye. Hiyo akiwoye is now the sympathy. And it's more of, when you talk about pity, it's more of, kai, at least I'm not in that particular situation yenye wako. So maybe if they're hurt, it comes from a point of, I am not hurt. You understand? It comes from a sense of, I am not hurt. Woye feelings. That is sympathy. But empathy is having the ability to embrace that emotion that that particular person is feeling. Then when you talk about compassion, it is now awareness of what the other person is suffering from, with a desire to do action to alleviate it. So let's come back again. Empathy is being able to understand. Sympathy is the feeling of pity, as I've put it, woye. And compassion is having that deep sense of awareness that usually coupled with a strong desire that you want to help them. So let's say, for example, someone maybe sema mtu aliumia or something, umeona ameumia. Kuna mtu atasema, ule aligongwa na gari, and then there's that person who akimsikia akipiga hizo nduru atafeel whatever they're feeling, and they'll have that desire of si tutafute gari tumchukue tumpeleke wapi? Hospitali. I hope it is clear. So when we relate with empathy, we give another person space for their own emotions and feelings. We reflect on what they are feeling, and we provide a safe space for all their emotion. So technically, when someone is when you want to when someone is empathic, let me say that. When someone is empathic, this type of person tends to provide safety. Safety in what sense? That whatever this person will discuss in whatever they're feeling, they feel like they're being understood. That is the primary goal of empathy, is to create a safe space for emotions, even though how negative they are. Even if it's anger, even if it is remorse, even if the feelings of betrayal, all that empathy provides a feeling of safety. When we relate with sympathy, we tend to move into problem-solving mode. And I know this tends to happen a lot. Like, mtu anakuambia kitu, and immediately the first thing that comes to your mind, what can I do to help this person or solve this particular problem? We usually have ideas and judgments on how this person feels and what they should do. This not only minimizes the person's problems, but it also ignores their feelings. And the worst thing that a person can tend to experience is the feeling of being ignored. And now let me just ask, how many of us have ever found ourselves, you're talking to someone, you're explaining a particular problem to them, and immediately, wakoya, you should have done this, you should have tackled this problem like this, you tend to feel you're ignored. Like, how many people have talked to such people and you feel like you're being dismissed? Actually, they say that they feel like they're being dismissed. And then when the person will ask you, What do you mean I've dismissed you? See, I listened to you. I gave you a solution to that problem. Like tumejipata wapi in that space. You know, you're talking to someone, but you feel like, no, this person is not helping me. Okay, in the real sense, they are. They're actually providing a problem to your solution. Hmm? Tumepata watu wangapi in that situation? You can use this emoji ya ku raise up your hand so that I can know if you found ourselves in such a situation where you're explaining a problem to someone and then you feel like you're being dismissed. But in the real sense, this person is not dismissing you. He's actually given you a solution. Have we found ourselves in such a space? Exactly. Thank you, Spencer. So that is actually what sympathy does, as we've seen. Sympathy tends to give us already into kicks us into problem solving mode, and it also minimizes how we feel, which is not the correct track, especially when we are going to hospital ministry. These people who are in hospital, they feel a lot of things. There are people who you will encounter when you go for hospital ministry who are long stay patients, patients who have stayed in the hospital for almost 6 months. They've not seen their family, they've not seen their loved ones. Even some of them end up being abandoned in the hospital. We have patients who are usually abandoned by their relatives in hospital. They were just brought week 1, week 2, and then after that when you do not see the relatives again or even the friends again. When you try reach out to the next of kin, the numbers are all blocked. So of course these people carry a lot of emotions, and it's worse off when they want to express these emotions and then they tend to feel ignored. So that is why it is important, especially when you're tackling hospital ministry. You need to be full of compassion, you need to practice empathy, and not sympathy, as we have looked at the differences. Empathy creates safety of emotions, while sympathy, you immediately enter into a problem solving mode. And instead of helping this person's feelings get minimized and they feel ignored. So even whatever you told them to do, they will not be able to do it. And as I continue, there's something in our field, especially nurses. We usually run something called we call nursing diagnosis. It's usually generated by the International Council of Nurses. We call it the NANDA list. And this is what helps us in evaluating patients and the care that we give. And one of the nursing diagnoses usually is it's under class G, under psychological. Under psychological, it talks about risk of hopelessness. Talks about risk of hopelessness. So you see, if this person's feelings are minimized, you're making this particular, let me say, client or patient, run a risk of hopelessness, which is not our objective. We as missionaries should be able to inspire hope this into these people. So, of course, when we are talking about empathy, we have to keep in mind that we have the greatest teacher when it comes to mission work. And our greatest teacher who taught us empathy and compassion is Jesus Christ. Yes, he himself is our greatest teacher. And we can find that in scripture, that is Matthew 14:14. One of us can read for us. Matthew 14:14. Someone can read for us Matthew 14:14. You can just unmute and just read aloud. Thank you so much. So every time when we usually do ministry work, let me use it now as a chaplain, the person who we emulate is Christ, because Christ is our greatest chaplain. He's the one who actually started this ministry. And every single time when you read through the Gospels, and when Christ is mingling with the people, he's performing all these miracles, there's always something that says he was moved with understanding, he was moved with compassion. Yani, even during the death of Lazarus, he saw how people were crying, and us as missionaries, we should be able to be moved by people's emotions and how they feel. So during the discussions, I like using a case study so that we can learn better and bring it to understanding. And our case study is coming from scripture. Actually, it is the parable of the Good Samaritan. There are a lot of lessons that are here, and I would like someone to unmute at the end of it all and tell me who showed sympathy, who showed empathy and compassion. Yes. So Luke 10, that is our studies coming from Luke chapter 10, verse 25 to 37. And I'll read in your hearing. It says, Jesus Christ was the one who was giving this parable. It says, "And behold, a certain lawyer stood up and tested him, saying, 'Teacher, what shall I do to inherit eternal life?' He said to him, 'What is it written in the law? What is what is it written in the law? What is your reading of it?' So he answered and said, 'You shall love the Lord your God with all your heart and with all your soul and with all your strength and with all your mind, and your neighbor as yourself.' And he said to him, 'You have answered rightly. Do this and you will live.' But he, wanting to justify himself, said to Jesus, 'And who is my neighbor?' Then Jesus answered and said, 'A certain man went down from Jerusalem to Jericho, and fell among thieves, who stripped him of his clothing, wounded him, and departed, leaving him half dead. Now, by chance, a certain priest came down that road, and when he saw him, he passed by on the other side. Likewise, a Levite, when he arrived at the place, came, looked, and passed by on the other side. But a certain Samaritan, as he journeyed, came where he saw me, and he had compassion. So he went to him and bandaged his wounds, pouring oil and wine, and he set him on his own animal, brought him to the inn, and took care of him. On the next day, when he departed, he took out 2 denarii, gave them to the innkeeper, and said to him, 'Take care of him, and whatever more you spend, when I come again, I will repay you.'" So I'd like to stop here and ask, um, in this story, we see 3 people who meet this man who was attacked by robbers. From Jerusalem, he was heading to Jericho. And 3 people passed him. 1, a priest passed him. 2, a Levite passed him. And 3, a Samaritan passed him. So, question to, let me see, the class now. Who among these showed compassion and empathy, and who showed sympathy? That's the first question. The second question is, who was responsible, if I may put it, who was responsible in showing empathy and compassion at the first instance when they met this injured man? So we'll start with question 1. Who showed empathy and compassion when they met this injured man on the road who was left half dead? Anyone can just unmute and say. Anyone? From the parable that we've read, who was able to show empathy and compassion, and who showed sympathy? Okay, just to save on time, we find that the Samaritan actually showed empathy and compassion. And actually, scripture acknowledges it in verse 33, where it says that, by a certain Samaritan, as he journeyed, came where he was, and when he saw him, he had compassion. And we've seen that compassion entails having a deep sense of awareness and having a great desire to do what is right or what is needful. And that is what the Samaritan did. And it's quite interesting that, this man who was attacked was, in fact, a Jew. And this Samaritan knew that if roles were reversed, you know what will have happened? He will actually have been left dead. If it was the Jew who was passing, he would have been left dead, because remember, the Jews and the Samaritans were not in good terms. Then, also, in the same parable that you've read, we've had the passing of the Levite and you had the passing of the priest. Ideally, these people should have had the heart to be empathetic and to be filled with compassion to help this particular man, But ironically, what did they do? They showed sympathy. It was an akiwoye situation, and they were not able to do anything because sympathy is what you yourself are feeling. Yes. So, as we continue, the commentary says this is Desire of Ages. It says, a certain Samaritan in the journey came where the sufferer was, and when he saw him, he had compassion on him. He did not question whether the stranger was a Jew or a Gentile. Now, Jew or Gentile, take it back to our hospital ministry. When you go to the hospital, you'll meet different types of people. You'll meet Hindus, you'll meet Jehovah Witness, you'll meet Muslims, and even atheists themselves, you will meet them. But that should not hinder you from showing compassion to these particular people. It should not hinder you from showing empathy to these particular people. Don't say I'm an Adventist and I'm a Christian just because you do not believe in the God I believe in. I cannot help you. I cannot listen to you. We should actually have the attributes of this Samaritan. The commentary continues saying that if a Jew, the Samaritan well knew that were their condition were reversed, the man would have spit in his face and pass him with contempt. I know tukiwa Hosi, by the way, it's true. If roles were reversed and some people found that maybe you are Adventist, they will refuse to do ministry. Let's say maybe it was Muslims or Hindus or whoever religion is coming. Some of them, they may not decide to associate with you because maybe they might time that you're not clean or purified or you do not belong to their particular religion. But that should not hinder you also from not doing your God-sent purpose. Yes. The commentary continues in saying that, but he did not hesitate on account of this. He did not consider that he himself might be in the danger of violence by tarrying in the place. It was enough that there was before him a human being in need and suffering. He took his own garment with which to cover him. The oil and the wine provided for his own journey, he used it to heal and refresh the wounded man. Continues to say, and he brought him into an inn and cared for him throughout the night, watching over him tenderly. And in the morning, as the sick man had improved, the Samaritan ventured to go on his way. But before doing this, he placed him in the care of the innkeeper and paid the charges and left a deposit for his benefit. And not satisfied with this, he still made a provision for any other need, saying to the host, take care of him, and whatever thou spendest more, when I come again, I will repay thee. Remember, we are sojourners in the world. This world is not our own. And Christ left us with a mission that we should evangelize. And when you're evangelizing, we're evangelizing to everyone. And yes, you may see that just going to the hospital and visiting them, maybe it may not earn your salary, it may not increase your money, you may feel like your blessings will diminish. No. It means that this is the great good work that we've been tasked. And when Christ comes back again, we will have our reward because we have done our complete mission to the fullest. We've done it to the fullest and to the best of our own abilities. So don't feel bad when someone asks you, let's go visit the sick. Just because si mtu wako ama si mtu wenu ama si mtu mwenye unajua, haimaanishi ati utasema no, siwezi enda. Remember that is your Christ, that is your Christian mission, that you should minister unto everyone. We continue. So when you're talking about empathy, when you're talking about compassion, and when you're talking about sympathy, all these revolve under something else, which is active listening. Now, active listening, you cannot do empathy and active listening separately. Both of them are intertwined. So you may ask, before I even go into active listening, I believe in Campus or in many other trainings, we've been taught about communication. And maybe I can ask, when someone asks you what is communication, what is your response? Someone can just unmute and tell us. When they say, what is communication? What does that mean? What is communication? What do you understand by communication? Why do people say that communication is a two-way traffic? You can unmute. What do you understand by communication? And what is communication to you?
I think communication is exchanging information between two people, and it has to be, of course, it involves two parties or more, and it must involve listening, hearing, not just listening, hearing, and giving feedback. So, yeah.
Okay, I'm seeing Lydia. Just a minute, I go to the messages and call messages. Lydia has made a very interesting statement. Sorry. Lydia, just type again what you have said. I cannot find it.
I've just written passing of information between people.
Yes, that's true. Communication is passing of information between two people. And I believe when you were studying about communication, you were told that there's the sender, there's the receiver, right? There's the message, there's the vessel that carries the message, right? That is how communication, those are channels of how communication works. So you see, you have the sender who creates the message, and it's carried maybe verbally or through call or through letter, through the written or unwritten channels, and it goes to the receiver. The receiver decodes the message, and then in that process is when he sends back the feedback or the response. So in active listening, we look at what this person is hearing. And communication is usually all round, it's verbal and non-verbal at the same time. It ranges from eye contact to body posture, to hand placement. All that is communication, to facial expressions. I don't have to say anything so that you know that I've communicated. Those memes where you see that, if you've ever come across these memes that when your mother gives you that look and you just know what it means, yeah, unajua tu hapa ni kubaya. already your mother has communicated. So that's communication. So when you look at communication, there's really the aspect of active listening. So what is active listening? This is the deliberate, empathic, you see empathy is coming back again, practice of fully concentrating on fully concentrating on understanding and responding to a speaker both verbally and non-verbally. So one, remember, this is deliberate, you know, it has to be intentional. You'll want to do it. You want to listen. Two, there's the aspect of empathy, as we have said. And we looked at empathy as understanding what this person is saying in their emotions, in their speech, in their tone, their tonal variation, in pitch, all that entails active listening. Understanding, processing what this person is trying to say, as well as now after you've all done all that, that is when now you respond to the speaker either verbally or non-verbally. It also involves engaging in an undivided attention when communicating. So, what does it mean to have undivided attention? This means like you're fully present. If you're speaking to this person, you're maintaining eye contact, your body is still, you're nodding to acknowledge that you're listening to what this person is saying. That is what it means to be having undivided attention. Not that ati mtu anakuongelesha, you're busy texting, you're busy calling, hey, wewe unasema unafanya nini? Alafu unamwambia nakusikiza. Ama uko hapo unachora map ya Afrika chini, or you're checking your nails. No, that's actually, it means your attention is very far. You're just hearing what this person is saying. Also, active listening as a plus tends to improve conversation. Now, I know when you go for hospital ministry, we'll have to engage and talk to these patients who are in hospital. And there are people who will say, how do I start this conversation? That's another aspect. That's another something else that will also be involved in the training. We call it therapeutic communication, where there's usually the initiation phase to the working phase to the termination phase. How do you start this conversation? How do you build the conversation? And how do you terminate conversation? One of the skills is active listening. So, yes, it improves on conversation. When you listen actively, when you hear what this person is trying to say, at least it brings some sense of understanding between the two of you. It makes the conversation easy, Even you can know, like, it can tell you where this person's mind or their mind is headed, like the direction they're taking. It becomes easier for you. And also it improves understanding. But keep in mind, just because you're listening actively, it's not a guarantee that you're going to end up in an agreement. That is why I've put it in bold and underlined. Just because you're participating in active listening does not mean that you will come into agreement with that particular person. So when you go to the hospital and you're speaking to these patients, and maybe they're explaining to you a particular scenario, and yes, you understand how they're feeling. Yes, you're understanding their emotions, Yes, you can relate with them. But it doesn't guarantee, like, it's not an assurance, an 100% assurance that they will agree with what you're feeling. Like, let me say, for example, maybe you're talking about someone who passed, who is their loved one. Let me give a case scenario. There's a time I was in the hospital and I don't know, I think I've ever told some of you guys this. Not long time ago, actually recently, there's a mother who came to the hospital and the baby died because of aspiration. And she was really grieving. She was actually really crying, And yes, I have lost a loved one before, so I do understand the pain that she's feeling, And we are there, we are talking, we are having the quiet moments, even in silence, just you being present does a lot, by the way. You don't have to speak, you don't have to say so much. Just you being present in that particular moment takes it by far. It takes things far. Yeah. So this lady ends up telling me that, actually, ironically, I know I should be feeling painful, you know, I should be feeling so much pain, nafaa kupiga nduru, but I I don't feel like that. I don't even, like, I don't have any emotion to process, you know? She just told me I feel like my heart is calm, you know? I'm not guaranteed, I'm not objectified that I was meant to feel with her with that grief. You know, that is what she was feeling. So it's not an agree that you, it's not a guarantee that you'll come into agreement in whatever the person is feeling. Someone may feel something different and you may be feeling something different, which in this case, Mimi, I related with the pain because I have experienced death of a close loved one. But for her, this is a child very close to her, but she's not feeling anything. She's actually feeling a sense of calm. Yes. And last but not least, it also helps us to understand the needs of the people who they have, or the needs that our people have. So when you listen actively, the people will, when you know, like they'll say, yeah, I do need a prayer. When you talk to them, they may hint that they actually want someone to pray with them and you'll actually pray with them. When you listen to them, the people who will say, I just want someone to just sit with me. I just talk till kingdom come. And that is all that they want. But if you do not listen actively, you'll end up doing the contrary. Maybe the person is clearly communicating with you that me, I don't like physical contact. And you're there rushing in to be like, ay, let me come and hug you. No, when you listen to this person, as we've said, communication, how it happens, it usually happens verbally and non-verbally. So you have to be very keen. You have to be extremely keen. Yes. So you may ask yourself, how can I be able to do this? How can I be able to show empathy? And how can I communicate actively or listen actively? One is listen without judgment. And when you're listening without judgment, this is where the skill of active listening, as we have discussed, comes in. You know, it means that in your mind, you have not created any preconceived notion, any preconceived conclusion, you know, or having any premeditated answers. That is one. Listening without judgment. You are there to listen. And that is one way you can create empathy. As you've seen, active listening goes hand in hand with empathy. And you cannot be empathy if you're not full of compassion. So these are great values that are usually embraced sana during hospital ministry. Two, you need to listen with intention. This is by, as we've talked about, using full and divided attention. Using full and divided attention, making sure that you're present in the moment as this person is speaking and expressing themselves. Two is listen without advice. Now, do not take away this person's power of sharing. And that happens a lot when people are, you know, when you're listening and advising at the same time. You need to pick one. It's either you listen or you advise. You cannot do them simultaneously, you know, because this person will be sharing, and immediately what in your mind is, you know, let's say for example, someone is talking about okay, in the hospital they'll be very practical, you know, and yeah, I understand us as Adventists we have read home remedies, and you know, we know all these treatments. Ukisema ati unaumwa na tumbo, take activated charcoal. You have a wound, use aloe vera to clean it. Let's say, for example, they tell you, maybe you have a when they're talking to you, of course they'll tell you what they're suffering from. Maybe that they tell you they're suffering from diabetes. They won't tell you diabetes, nakwambia niko na sukari. So yes, they'll tell you niko na sukari. You start telling them, you know, new start. That should not happen. Don't go ahead and do that. Just listen to them because they're in hospital and they're receiving treatment, you know. And when you start talking about that, you're taking away the person's sharing the person sharing power. Just let them talk and make up their own conclusions. And if they ask for advice, ask them what they think they should do. Okay. So if they ask for advice, let's say, for example, you meet a patient, like this is actually a correct example. When I was in Thika level 5, there's a particular family that came to visit. I was in male surgical ward. And there's a family that came to visit their loved one. We used to call him Saimo. Actually, he told us his name is Saimo. And you can't change because ukimwita jina ingine, he never used to respond. Yeye alikuwa anasema mimi naitwa Saimo. And this person was actually a chronic alcoholic. And the family that came also was a chronic alcoholic. You may ask me how I know. It's because one of the brothers came and told us that, yeah, also in our family we take a lot of alcohol, but mimi nataka kuacha pombe. Now, I know you'll be so quick to tell them, yeah, it is good. You should consider going for rehabilitation. You should cut down your drinking. It can make you sick. There's liver cirrhosis. Alafu, there's illicit brew out there that is being sold. Utakunywa siku moja, you go blind. It is very good that you stop. It is also affecting your family. No, just calm down. Let the person speak out, If the person comes and tells you, yeah, I want to stop drinking, just ask them, why do you want to stop drinking, And let them speak. Allow them to conclude for themselves. And if they ask you what they think you should do, you should ask them, okay, you've mentioned this and this and this. What plans do you have? What do you think will make you cut this drinking? Give them the ability to come up with their own solutions. And as I said, when you do that, it tends to reduce the risk of hopelessness. As I've told you, that's usually one of the nursing diagnoses when you're giving psychological care to the patient. Is one of the diagnoses that usually run so much, especially for patients who have chronic illnesses and long stay patients. Some of them tend to lose the will to live. So when you give them the ability, when you give them the power to share whatever they're feeling, come up with their own conclusions and solutions, that is something that really empowers them. It gives them another reason as to why they should tackle another day. And considering that you're going to Machakos level 5, keep in mind, if depending on the ward that you will be going, let's say if you'll be going to medical ward, you will be meeting patients who have different illnesses. You'll be meeting patients from suicidal attempts. You'll be meeting patients from cancer patients. You'll be meeting patients who have transmitted HIV. You'll be meeting patients, who have, as I've said, diabetes. You'll meet patients who have suffered traumas, Some of them have unexplained illnesses. You'll meet some of the dischargees who got sick, but then because of the hospital bill, they've not been allowed to leave the facility. So kindly, do not take away their sharing power. Let them talk. Then, as you continue doing active listening, also listen with understanding. What does it mean to listen with understanding? It means affirming what they're feeling. If they tell you they're in pain, tell them, yes, I understand. Affirm whatever they are feeling, because they're human. You cannot dismiss their feelings. Affirm it. Even if you do not agree, even if you do not accept what they're feeling, it is them, not you. It is them, and them alone can feel those feelings that they're feeling. Then, last but not least, listen with vulnerability. What does it mean to listen to vulnerability? It means that if you have encountered a similar experience, you can be able to share it with the patient so that they may understand that this journey that they're undertaking, they're not alone. It gives them hope that, yes, I know there's someone who has passed through a similar situation and they made it. So why not me? I can also make it. So as you said, listen. How do you practice empathy and active listening? 1, listen without judgment. 2, listen with intention. when you're going there, have undivided attention. In fact, if possible, just switch off your phone, just to avoid interruptions with calls, messages, texts. Yes. Number 3, listen without advice. Number 4, listen with understanding. And the 5, listen with vulnerability. Yes. So that is how you practice empathy and active listening. So maybe kuanzia kutoka hapo, before I go to the next subtopic, I'll allow questions for now before we continue. Yeah, unless there's any question. Any question, any comment? Any question before we continue? Okay, I think we can proceed, and then we'll continue to the next subtopic. Yes. So our next part is hospital etiquette. So this is how you basically carry yourself in the hospital. How do you go to the hospital, if I may say? And I think this was among the first classes that I had to attend also when I was a chaplain, as well as when I started medical school. This is among the first classes that we had to attend. So point number 1, you need to dress smartly, decently for the ladies. You need to dress smartly and decently. For the ladies, the hem of the skirt or the dress that you should wear should be at least 2 inches from the ground. At least 2 inches from the ground. What does 2 inches represent? At least slightly above the ankle. So usivae skirt mrefu ya inafagia chini. No. Why? This is a hospital, and more or less likely, we wouldn't want you to carry microorganisms to your home, because there are lot of microorganisms. Some of them, in the hospital, we have to literally disinfect and sterilize surfaces. So it will be really bad if you carry those organisms to the house. And then, if your clothes are not taken care of properly, then you get transmitted, such and such. It will be a very bad, nasty situation for you. So make sure whatever cloth you're wearing, it's at least slightly above the ankle for the ladies. The skirt you'll be wearing, the dress you'll be wearing, at least slightly above the ankle. 2, you wear low-heeled shoes which are closed, or flat shoes and if you have laces, tie them. Why? 1, to prevent trips. You don't trip, you don't fall, because the hospital floor usually has so much fluid going on. It can be anything from mucus to urine to blood to semen to whatever it is. They can be a lot. So yes, there's a lot that goes on in the hospital floors. So wear flat shoes so that you can be stable, and where you're walking so that you don't trip and fall. 3, remove anything that hangs loosely around your neck. So, or your hand, bangles, watches, remove anything like that, because you never know. Sometimes we really admit medical patients into, psychiatric patients into the medical ward. The patients who are usually very violent. You never know. Wanaweza kushika mashati. So be very careful. If you're wearing a tie, I won't advise you to wear a tie, because kuna mtu anaweza kushika tu hivi, avute tu mara moja, and you become our next patient. So please, yes. Do not have anything that is loosely around your neck, because you never know. There are patients who are very and extremely violent, which brings me to the point. I've not added it here. If you meet a patient and you find the patient has been restricted, and what do we mean restricted? They've used mechanical restraint, where you find maybe the patient's hand has been tied. Please do not untie that patient. Kindly. Do not untie that patient, and that is for your own safety. Do not untie that patient, because there's a reason as to why they have restricted that particular patient. I know you may go there and you may think it is very inhuman. Trust me, we understand. It is also in the ethics, when to use and when not to use mechanical restraint. And most of the time, you find that if a patient is restricted, it's more or less that this patient can prove harm to themselves. When they have medication, when they have their IV lines, or when they move around, you may find that they've stuffed scalpels like blades, or they tend to remove the oxygen tube that they've been given, the feeding tube that they've been inserted. So maybe that is the reason as to why they've been restrained. Yeah. Or they are very, very aggressive. So do not do anything about it. You may ask the nurse who's around why the patient has been restricted so that you may know how to handle yourself, but do not open the patient's hands, even if they ask you. And I mean, even if they ask you to loosen those restraints, go look for the nurse who's around and ask them and tell them that the patient wants their restraints to be loosened. Don't do it yourself. Point number 4, I think it's 5, ensure that you do not sit on the patient's bed. Now, I know you'll be going to a public hospital. Please do not expect chairs. I'll tell you. I tell you for a fact, there are no chairs in the ward. Unless you're going to a private facility, at least that's where you'll find a chair bedside, which ideally, in practice, should be there. But, it's the government of Kenya. There are usually no chairs. So don't sit on the patient's bed. You may feel like it's a bit cruel, but there's a reason. Because sometimes the patients we have medical devices connected to them. And when you sit on the bed, you never know, you may actually tamper with them. There's a patients who have inserted catheters, and when you sit with them, they block. So you never know. Or there are patients who, release secretions, alafu unaweza kalia by mistake, you may find there's maybe blood, maybe there's, so much fluid, there's pus, there's oozing wounds, and I think that would actually be really nice to sit on something like that. So that is why we tell you, please do not sit on the patient's bed, because you never know what you will come into contact with, and then the next time ukirudi uwe ndio mgonjwa. Yes. Number 6, be polite and courteous when addressing meant patient, not prefect. Patient. Be kind and courteous. Introduce yourself. If they tell you they don't want to talk, please respect that decision that they don't want to talk. If they tell you they want to sleep, do not force issues. Allow them to sleep. Why? It's because the hospital is usually busy. You may find maybe this particular patient has medication, was given medication. Okay, let me give you an ideal picture. Was given medication at 3 a.m. Akamshwa 6 a.m. kukunywa breakfast, was waking up again at 7 a.m. to make their bed, was waking up again at 9 a.m. to be given medication, was waking up again at 10 to take vital signs or do the medical procedures. At 12, wako na relatives, and then during the day again at 3 p.m. has medication. I mean, what time does this patient have time to rest, Some of them are usually actually very tired and very exhausted. That's why sometimes watu wakitoka OC, when they tell you they're tired and they don't want to see anyone, it actually makes sense. You are tired, because you may find that instead of getting a complete bed rest, you end up interrupted. Or maybe you may find this patient actually came from a step down facility. So let's say maybe alitoka from ICU or HDU and then came to the general ward. And in ICU, remember, there are machines that are usually beeping every single time. So this person ideally is not even sleeping. And now that they've come to the general ward and these machines are not there, this patient actually wants to sleep. So when they tell you that they don't want to talk, or they tell you that they want to sleep, please understand that they want to sleep. And if you may ask them, you may want to come at another time, and they tell you yes, sure, you can do that. Just respect whatever the decision they made. Higher. The last but not least is when you're leaving the patient bedside, remember to wash your hands. So there's usually 5 points of contact when you need to wash your hands. 1, when you're going bedside. 2, when you're in contact with the patient. 3, because you're not medical practitioners, you should wash your hands before you do any medical procedure and after you do a medical procedure and after you leave the patient's bedside. That is when you need to wash your hands. But now, since we're coming for visiting, wash your hands before you come into contact with the patient, because there are patients who are highly susceptible, to other environmental contaminants. Wewe mwenyewe ukiwa healthy, you're healthy, you will not succumb to them, but for them, because they're already compromised, the immune system is compromised, they will tend to succumb. Yes. And after you're done bedside, you make sure you wash your hands again, because you never know, unaweza toka tu hapo and immediately you want to eat something, and then remember, maybe umekutana na patient mwenye ako na active case of diarrhea, and maybe you don't know, maybe it can even be cholera, GE, typhoid, amoeba. Please wash your hands. And lastly, watch your feet and your step. Whenever you're walking, watch where you're walking. Don't kanyaga fluids, unknown fluids. You never know what that they carry. So yes, that is a small presentation that I had today for you guys. There's many more to cover, as I've mentioned some of the parts. There's the aspect of debriefing, there's the aspect of how to carry out communication, Yes. I hope the other trainers will be able to cover that too. Over to you, Spencer. And if there's any question, I would love to answer.
Yes, so good evening, everyone. Let me start by thanking Faith a lot. I'm just having a feeling that we need another session with Faith, because I've learned a lot that we will not only apply during this visit, but we will also apply in our day-to-day activities. So thank you so much, Faith. We can change our mind. We give you we give you another session. Then on the issue of t-shirts, we will finalize. Then we communicate, and we will also communicate so that we